Hi, my name is Cyrena Arokium, and I'm a junior biology major on the pre-med track with a minor in biochemistry at Spelman College. My research focuses on cultivating a community of practice for cancer survivorship care in primary care settings. I had the privilege of working with Dr. Shauna Hudson and her team at Rutgers Cancer Institute and Rutgers Robert Wood Johnson Medical School. Why cancer survivorship care and research? Cancer survivorship care in primary care settings is an increasingly critical area as our population of cancer survivors continues to grow. Currently, there are more than 16 million cancer survivors in the United States who are living 5 or more years post-diagnosis. By 2040, we're expecting this number to reach approximately 20.6 million survivors. Primary care plays an essential role in cancer survivorship care, which encompasses the health and well-being of individuals from diagnoses to the end of life. This includes managing not just the physical effects of cancer and its treatment, but also the psychological, social, and economic challenges that survivors face. The survivorship care these patients need is complex. It involves screening for new malignancies, surveillance for cancer recurrence, management of both acute and long-term physical and psychosocial symptoms, health well-being, and coordination between cancer specialists and primary care teams. However, there's a significant gap in delivering follow-up care after cancer diagnoses. This stems from limited evidence-based strategies and a knowledge gap among primary care physicians about survivorship care and what it entails. As a result, a network was created to address these challenges and key issues. In collaboration with the National Cancer Institute Office of Cancer Survivorship, Dr. Shauna Hudson and her team created INSPIRE, which stands for the Interdisciplinary Network for Survivorship and Primary Care Research and Education. This network fosters collaboration, provides a platform for advancing research, and integrates primary care and cancer survivorship collaboration. What has also been identified is that there is a need to enhance support for clinicians and researchers interested in primary care and survivorship care delivery research on how best to meet patient needs in primary care. Right now, there's only 23 grants funded by the National Cancer Institute. The INSPIRE network operates through 4 work groups to address these issues. The first is developing care delivery research, capacity building and partnerships, training and career development, and lastly, survivorship education and competencies. Central to all this is collaboration between primary care physicians, oncologists, and other specialists to ensure evidence-based programs for cancer survivors are adopted, implemented, and sustained. Right now, this network is an ongoing project, and the goal is to provide support and a community of practice for researchers working in this area. Here is a more in-depth look of the current work groups that the INSPIRE network operates through. Care delivery research, which develops research agendas, focus on identifying and managing survivors in primary care, building capacity and partnerships by connecting primary care focused organizations to expand resources, training career development, which conducts network analyses and plans mentorship for early career researchers, and lastly, survivorship education and competencies, which refines competencies for primary care providers. The work is grounded in the coordinated care cancer survivorship model, which is shown here. This model emphasizes team-based care coordination between patients, primary care clinicians, oncologists, and specialists, supported by informational technological innovations for longitudinal care. The model addresses key components, including identifying survivors, care coordination, non-visit outreach, shared care plans, and comprehensive outcome metrics. Potential interests include focus on implementing personalized care plans informed by cancer guidelines with a patient-centered approach, developing telehealth cancer clinics that connect care coordinators with medical teams for accessible consultations and monitoring. However, a key challenge is that electronic health records often don't capture the full patient journey before or after cancer clinic visits. As this network builds capacity, We hope to be better positioned to examine the multiple layers of survivorship care, from monitoring reoccurrence to managing comorbidities and socioeconomic needs, as well as discussing goals of care. Thank you for your attention, and I welcome any questions the day of the conference.